Welcome everybody to the October meeting of the nonprofit plant-based nutrition organization of Wisconsin. I'm Terry Lynch. The mission of our nonprofit group is to educate, inspire, and support each other on an evidence-backed whole food plant-based nutritional path for health and improved quality of life. It's quite a mouthful. Our group is open to everyone, those plant-based and those just curious about it. It's meant to be a non-judgmental place for you to come get information, inspiration, and support. If you'd like more information about our group, our upcoming meeting dates, speakers, and other events and resources, you can go to our website, pbnow.org, or find us on Facebook or Instagram. As we do each time, can I see a show of hands, either by raising your hand or using the thumbs up icon down in the reactions portion of your Zoom bar on the bottom, of how many of you are currently following a plant-based diet? That's great. That's about almost half. As we mentioned at the beginning of each meeting, the evidence of the benefits of plant-based nutrition in improving health and quality of life for people of all ages, as published in non-biased medical research, is quite striking. Whether it's improving health through increased energy, weight loss, preventing, slowing, stopping, or reversing problems like allergies, digestive problems, diabetes, heart disease, early dementia, or increasing our quality of life by helping us feel better, strengthening our immune system, increasing our endurance, improving athletic performance, speeding our recovery from exercise, reducing joint pain, clearing our thinking, or reducing the physical, emotional, and financial side effects of the illnesses, drugs, and procedures often recommended to treat the conditions plant-based nutrition can help us avoid. The research shows that our bodies do a wonderful job of healing themselves if we stop damaging them daily with poor nutrition and start giving them the nutrition they need to heal and function optimally. It's truly remarkable. Now let me tell you what's in store for you tonight. Tonight we'll hear from 4 people. We'll begin with a joint interview with a physician and a pharmacist who practice in the area. After our interview, plant-based cook Amberly Childs will share a recipe with us. And around 6:30, our featured speaker, cardiologist Dr. Joshua Liberman, will talk about your heart on plants. We'll follow that with about a 20-minute Q&A period. And the program, we try to end the program right at 7:30. As a reminder, we have meetings every month, usually on the second Thursday of the month at 6. You can find out more information again about our upcoming meetings on our website at pbnow.org. A quick technical note: during the meeting, everybody but the speakers will be muted, and we ask that you stay that way to avoid background noise and to make sure that everybody gets a chance to hear what the speakers have to say. All right, here we go. We'll begin by talking with 2 area healthcare professionals to hear about their personal and clinical experiences with plant-based nutrition. First, let me introduce Tamara Strubing, who received her doctor of pharmacy degree from the University of Wisconsin and is board certified in ambulatory care. She practices in the Freighter healthcare system. And we'll also be talking with Dr. Greg Blummel, who was trained at the Medical College of Wisconsin and is board certified in both internal medicine and lifestyle medicine. And he also practices in the Freighter healthcare system. Welcome, Dr. Strubing and Dr. Blummel.
Thank you.
Thanks, Terry.
Let me start by asking each of you, and I'll go to Dr. Blummel first here, to tell us a little bit more about your backgrounds and your practices.
Thanks, Terry. Right, I'm product of the area. Grew up in Menominee Falls. Went to the medical college. Had a stint in the Air Force where I learned about, of all things, process improvement, root cause analysis. It was a very good experience overall. Currently I'm in internal medicine practice where probably 80% of my patients have 2 or more chronic conditions. So that's where my focus is today.
Wow. And Dr. Strubing, could you?
Sure. I'm a pharmacist. I'm a clinical pharmacist, so I work with Dr. Blummel, and I support family practice and internal med. Most of what I do is I work with patients with type 2 diabetes, but I also support other patients who have either high blood pressure or high cholesterol as well. And what that means is my job is to help people reach their blood sugar goals in between their regular office visits. So I work along with Dr. Blummel to help adjust medicines, but we also follow up on, diet, nutrition as well, and lifestyle changes.
And Dr. Strubing, why don't we start with you first on this one? What kind of education did you have in your medical training, and what have you picked up since, or where have you picked it up as far as plant-based nutrition is involved?
So formal education has been very, very limited. Like I said, I've been a pharmacist for 20 years, and they really even still do not teach a lot of this stuff formally in school. So a lot of what I've learned over the years is either through personal experience, through colleagues, meetings, attending groups like this, and a lot of reading. So I'm always trying to keep up with what's current, especially in the medical literature that applies especially to my type 2 diabetes population. And that nutritional and lifestyle changes are one of the first parts of the guidelines, but they're often overlooked. And we go right to the pharmaceutical aspects of it. So I try to focus more on the pharmaceuticals, focus more on the lifestyle changes, and then, try to add on those pharmaceuticals as we need to.
Dr. Blummel, as far as what, and you talked about this, I think, last month as well, but what kind of education, or where have you picked up your knowledge of plant-based nutrition and the benefit of nutrition in medicine?
Yeah, I think the journey started around 2007 with T. Colin Campbell's, book, The China Study. And at that time, it was probably as motivated by my own family history of premature heart disease and prostate cancer as anything else. And it began to, change how I practiced medicine as well. Although at that time, there was not a lot of enthusiasm for discussing plant-based eating here in West Bend. And it wasn't probably until, I shared that same book with Gibson, and he embraced it and took it to a whole nother level that I got reinvigorated in being able to try to bring that to my practice a few years ago. So then the formal education started with the American College of Lifestyle Medicine, and their curriculum included just a lot of review of the literature related to outcomes and in plant-based nutrition. So that really was the formal part of the education.
Could you elaborate just a little bit more too on the College of Lifestyle Medicine and
yeah, I mean, ACLM, boy, I should know exactly what year that was originated. It's just in the last 10 or 15 years really has just blossomed. But it's got the pillars of nutrition, of exercise, of stress reduction. It's a very holistic approach, which I really appreciated. And they make it a point to make it easy to access all of the information. The one thing I really liked about ACLM is their positions on outcomes and plant-based is all evidence-based. There's really no room, I shouldn't say, well, there's always room for that, but no room for conjecture. There's senses, if we're going to say things like apple cider vinegar helps you lose weight, you need to be able to show the study. On the other hand, if gummy apple cider vinegar is, somebody asked me about that, I might say, I don't know. I haven't seen the studies on that. So, it's really about making sure that, what we're doing, what we're saying is backed up by good data.
Dr. Strubing, just from a general standpoint, what are your thoughts about whole food plant-based nutrition?
Um, so all the guidelines recommend trying to incorporate as many fruits and vegetables into the diet as possible. Okay, so that's the foundation of most of the current guidelines out there for chronic disease treatment and prevention. And when the people that I work with, when I say prevention, a lot of the people I work with are 45 to 90 years old. I usually don't have a whole lot of the young ones, but they have children and grandchildren. And so when I say prevention, we need to work on, incorporating that kind of concept, not just for ourselves, but also for our children and our grandchildren. So it's a part of every treatment regimen. I can't think of a single, clinical guideline that does not have this in there as part of their foundation, but it's often overlooked or kind of skipped or not really discussed. So I think that needs to be a bigger portion of what we think about when we're talking with patients.
Dr. Plummel, same question.
Well, I really like Tamara's answer. So I'm going to take a slightly different approach because it's an open-ended question. And this is really how I think about whole food, plant-based. I think there's kind of three constructs that I imagine. And I like to think about what's underlying all this. Why is this approach so healthy and so broad? Well, I think about it as far as, the first part of this whole idea of whole food is, the lack of processing of the food. So the body of evidence around, the prevention and the reversal of heart disease is so compelling. But the notion that nature, it really packages up the nutrition into an intact cell wall was really meaningful to me, right? So when you take a grain of wheat and you take the husk off of it and the germ off of it and you pulverize the interior, now you've got something that the structure is completely changed and clearly doesn't have the same health benefits as a wheat berry, for example. So intact cell walls. The other key construct for me is the relationship between our food and the gut. And that area is just exploding. And you've talked about it here at other times. But just knowing that 70% of our immune system is related to the GAL, or the gut-associated lymphatics, it's an area of emphasis. And when you take care of your microbiota, the bacterial flora in your gut, they take care of you. They produce things like short-chain fatty acids, butyrate, and that settles down the lining of the gut, and the immune system settles down. And the third construct is just sort of the inflammatory nature of a high meat diet in general. So with those three areas in mind, I'm able to I think communicate to people, at least in a way that makes sense around multiple different conditions.
Dr. Plummel, what you mentioned communicating to people. How do you incorporate this in your practice?
Yeah, well, I look for opportunities where there's openness. I ask people what their goals are, and I find myself challenging them to the notion that they could be healthier in the future than they've been in the last number of years. And if that piques their interest, I explore it further. I don't want to get preachy, right? I want them to, really ask for more information. So some of this is just about, the readiness and getting a sense of, what problems they see in their health that maybe we can help solve without medicines or, more medicalization. So it may end up, because we're always, short of time on this topic, we may end up just, I may end up giving them information to read more, to watch one of the Netflix videos, Game Changers, or get to nutritionfacts.org, Dr. Greger's website. Those typically, is where I will point people. And then I try to get them over to see Tamara.
And then what do you do, Tamara?
So after Dr. Blumels, I had a conversation with him. He's kind of laid some of the groundwork, and then they get to me and they're like, as a pharmacist, I don't have a background in nutrition, but we start laying some of the ground. We start laying some of that conversation down. And one of the big parts of my role is to break down barriers. And so we start talking about, where are they at on this process? What are their thoughts? What are their feelings about it? What is, some little baby steps we can start doing to start incorporating things into their lifestyle? Because with a lot of the patients I work with, it's not just them in the household, it's the family. And if their spouse or their children aren't on board with this, it's hard to shift the whole family eating dynamics to match up with what's being said here. And they might be really engaged with it, but they're fighting an uphill battle sometimes. So we talk about, what is something you can do? Maybe it's, we change breakfast a little bit, we change lunch, how about we change a snack? Whatever that is, we start trying to make some little pieces of groundwork. Part of the population that I work with also, again, part of that barrier is they have limited resources. I have some folks that I work with that the food pantry is their main source of nutrition. And I don't know if anybody's ever been to a food pantry, but it's a lot of refined carbs. And so we talk about, what can we get out of that could be a possibility to be a healthier choice. And so we start trying to shift the needle just a little bit at a time. And I have the privilege that I can talk with people as much as they want to. So if they want we want to talk every week, I can do that. We talk every couple of weeks. One of the other resources we have with where Dr. Blumel and I practice, we have some really great dietitians in our diabetes education department that also teach a lot of this too. And so we can refer people down to that department, and they will spend a whole hour, maybe two, and a visit going over some of these lifestyle and diet concepts. So we can pull them in as another resource to start working with folks.
So outstanding. And we've got maybe 3 or 4 minutes left. Maybe if each one of you could do a minute or so on what kind of changes you've seen happen in people's lives when they have embraced whole food plant-based nutrition. Tamara?
Well, so I'm a pharmacist who doesn't like medications, which sounds really kind of odd. And I tell patients that right off the bat. So one of the things we focus on is, my job is to help you reduce your medication burden. And as they make this journey towards changing not only their diet, but maybe their exercise habits, because those go hand in hand, then we start reducing their medicines. And my job is to make whatever medicines they're on match up with how they're doing clinically. So how are their numbers looking? How are they feeling? As they start to lose weight, we really start to back off on a lot of this. So some of the best things is people reduce the number of medications, they reduce the cost associated with all of that, and they start feeling better about how they're doing. And it kind of starts perpetuating them into better and better health outcomes.
That's outstanding. Dr. Blumel?
I don't know. Can you, I'm going to try something. No, you're not going to be able to see that with this. I have, with Epic, I'm able to chart out weight versus glycohemoglobin. So some of my patients, many of my patients are diabetic. They're really motivated to lose weight. So this is the segue into this conversation. And then when I see them back and I show them that there is a direct link between their average blood sugar and their weight, it's further motivational. And, I'm sorry I'm not able to show that, but I've got a few examples of that over time that it's just really, it makes you wonder if medications for diabetes does anything at all when you see the relationship between weight and blood sugar control. So, weight is if they can lose weight on this plant-based diet, it's really an incredible reinforcing point.
And have you ever seen anybody go on a plant-based diet and do it correctly and not lose weight? Who was weight in your?
I don't think so.
Me either.
Yeah, it's pretty. Yeah, it's in the experience, the limited experience, the anecdotal experience that I've had. People lose weight the way they should lose weight. Instead of losing 5 or 10 pounds in a week, you're losing a manageable amount every week, but it just keeps coming off and keeps coming off until you get to that weight that you should be.
Yeah.
Well, thank you both so much for this time. I wish we had more time on this, but thank you so much. And
You're very welcome. Thank you for having us.
Look forward to talking with you again. And I would ask, I don't know if you can put in the chat how you can be contacted.
Okay, sure.
Sure. Mm-hmm.
Great.
Hey, Terry, it's Josh here. Can you hear me?
Sure, Josh.
I just wanted to point out one thing. There is actually a diabetic-friendly food pantry in town. I don't know, just because there was a comment obviously made about patients and eating a plant-based diet can be a little bit expensive, and if you're especially, it doesn't have to be though, but especially if you're dependent on a food pantry, then you can't always get plant-based foods. This is all true, but there is at least a diabetic-friendly food pantry. It's on MLK and North Ave about that. It's at the Ebenezer Church, it's a little bit north on MLK, but it's actually set up by Ascension, or it's co-sponsored by Ascension, who provides most of the funding for it. But they actually have a really, really good selection of foods there. So if you have any, if there's anybody on this call that has any patients or friends or anybody that needs that kind of help, there is something in town.
Perfect.
That's excellent. And I think Tamara and Dr. Blumel are both in West Bend. Is that correct?
Mm-hmm.
Yes.
Right. So but I was unaware of that. Thanks. That was Dr. Josh Liberman, our cardiologist here in Milwaukee, speaking. So once again, thank you very much, Dr. Blumel and Dr. Strube. And our next speaker is a plant-based cook, familiar to most of you, I think, on the call here. She'll be sharing a recipe with us tonight. She's the founder and operator of the Milwaukee company Plant Joy, through which she teaches plant-based cooking classes and offers an ever-expanding menu of home-delivered or pickup plant-based meals, providing an easy way for people to incorporate plant-based nutrition into their daily lives. You can find out more specific information about her and Plant Joy at plantjoy.net. She was trained and certified as a plant-based cooking instructor in the Food for Life program run by Dr. Barnard's Physicians Committee for Responsible Medicine in Washington, D.C. There are a number of Food for Life certified instructors in the country, but many areas of the country don't have the luxury of having one nearby. We not only have one here in Milwaukee, but she is excellent. To share with us a plant-based recipe tonight is plant-based cooking instructor Amberly Childs. Amberly? You're muted. You're muted. There you go.
Hello.
Oh, hello.
I'd like to share my screen, Terry, if possible.
Sorry about that. I will get that up here.
No, that's okay. I joined a little late, so I didn't get to.
Not like me co-host. Okay, you should see that popping up. The co-host.
Oh, wrong button. Sorry.
Oh, nothing's coming up.
Hold on. I just have to.
Make.
Sorry, everybody. So where does it pop up? Share. There it is. Okay. Only host all participants who can start. Okay.
Yeah, once you do that, you should get this share screen availability on the bottom of your Zoom screen. There we go.
Okay, there we go. Can everybody hear me? Hopefully, I'm off mute. Hello, everybody. Nice to be here tonight. Happy fall. Let's turn this guy off. So thank you, Terry, for that wonderful introduction. It's nice to be here and to see everybody. And I thought, fall's the perfect time to talk about root vegetables. Right now, you're seeing tons of pumpkin, tons of squash, carrot, sweet potato. All the carotenoids are out there and they are ready for you right now. And so this is one of my favorite recipes from the Physicians Committee. And so lentil pumpkin curry. And what I like about this is it's light on the curry, and it can be lighter based on your love or learning to love curry. Curry kind of gets a little bit of a short stick sometimes. People just go, I don't like it, and they just kind of push it to the wayside. But curry is really good, and if you don't know, curry is basically a blend of a handful of spices, and curry changes based on the region. So if you're in North India, if you're in Southern India, maybe your family has a special curry blend that they use. So based on the region that you are in the world, you might have a different flavored curry, a different spice level of a curry. So it's real interchangeable. And so that's what I like about this recipe. So obviously it looks really pretty here, but I'm going to just go back and show everybody really quickly. So I'm on the Physicians Committee for Responsible Medicine's website. And if you're not familiar with them, they have a absolutely fantastic, here we go, recipe resource. I'm under recipes for fall. They have recipes for summer. They have recipes for winter. They have appetizers. They have possibly everything you could want. So one of the things I'm doing, if I say I have, right now I've got some asparagus in the fridge. I'm like, I got to use this in the next couple of days. And maybe I'm just not, a recipe or a flavor profile isn't coming to mind. I'm going to come on here and I'm going to go into the little search category and I'm going to type in pumpkin. There we go. See, I've done it before.
And this is all free, right?
These are all free recipes, 100%. So it's moving a little slowly, but you'll see what's going to happen. And so basically, you're going to have, if you look here on this part, you can really filter this by what you're looking for. But the recipe that we're going to talk about right now is this lentil pumpkin curry. So it's really unique to kind of put lentils with the curry. And that's one of the things that I really love about this. And so when we scroll down here and we take a look at the recipes or the ingredients, calls for a mild curry powder. If you're feeling you want something more, you can always add some sriracha. You can always add more heat to your dish. But we've got some real simple ingredients: coriander, which is also a version of cumin, cinnamon, garam masala. Most people, you can find garam masala at almost any store or spice house. And then really lentils. So another thing that I like about this recipe is, so if you're new to plant-based eating, or you're like, I'm not really sure that I want to eat beans every day. I want to eat beans every day, but I've been eating plant-based for over a decade now. So for me, beans are I need them. But lentils, split peas, and the smaller beans are much easier to digest. And they're also easier for our stomachs to break them down. But we still get the benefit of the fiber. We get the benefit of the protein that comes from that bean. And there's tons of other nutritional benefit also within that bean or legume. So I really like this, as I said, because lentils are a really nice way to introduce beans into our diet. People will complain sometimes, say, well, I eat beans and I get gassy. Well, everybody's going to get gassy. It's the body does this, right? However, one thing you can do to try and eliminate some of that is, if you soak your beans before you cook them, you can kind of take down some of those digestible fibers or indigestible fibers, and it helps your stomach kind of manage it a little bit nicer. So I'm going to share this link in the chat. But if you wanted to take a screenshot, take a picture, now's your time. Here's your ingredient list. And really, there's two ways that you could cook this. You could cook the lentils dry, like soak them and then cook them in the meal, or you could have cooked the lentils ahead of time. So if you're someone like me and you're a chef, I have cooked grains and cooked beans always in my fridge, ready to add to a salad, ready to just eat straight out. I eat black beans like, you know, they're my favorite candy. And so if you have lentils already cooked and ready to go, then all you would have to do is prepare part of this recipe, which would be your pumpkin or your sweet potato. And on that line where it says pumpkin, sweet potato, like, don't be bound by those two. You could literally take the pumpkin that you're going to use for Halloween and you could save some of it, right? You could go to Trader Joe's and you could buy cooked lentils already in the can. You could buy yams in the can. The challenge with that is most yams come in a sugar sweetened sauce of some kind. So if you are in a pickle and you're going to use those yams, I would highly recommend draining them and getting off any type of sugary syrup that goes on it. So finding those cooked lentils could be a time saver. And that's also a really good tip for people who are cooking for one or maybe just for two. Maybe you're like my husband and you don't like leftovers. And so he likes it when I cook smaller meals so we eat them all. Where I'm like, no, double down. I want 2 and 3 meals to make it easier in the upcoming days. So this is, I'm going to flip down here to the nutritional content here before I turn it over to some questions. But you can see, looking at this, this is a really nutritional powerhouse meal. Look at the protein you're getting. Those carbohydrates are not simple carbs. They are complex carbohydrates because more than likely you're eating a squash, a butternut squash, a sweet potato, something that has a lot of fiber, a lot of flavor, but it's also going to be healthy, complex carbs. You've got sugars in there, but they're natural sugars that are already a part of that. I mean, you could eat a sweet potato, in my opinion, and you never would need any sweetener on it because once you start to roast a sweet potato down or bake it, it'll caramelize a little on the outsides, and you'll find that you could eat it plain, maybe just a little bit of cinnamon. If you feel you're in transition and you need to, you could add a little bit of plant-based butter to that and cinnamon as well. But I'm really impressed by the nutritional profile of this meal and also by its versatility, by being able to use those lentils. If you didn't have brown lentils, you could use green, you could use a split pea, it could be a red split pea, a yellow. So really you have a variety of beans that you could use. And then one thing I forgot to mention is, scroll down here, look on that bottom bullet point. There's lemon juice that goes in here with apples. So you're going to get, again, some natural sweetener that comes in, and that citrus is really going to help. And that acid is going to bump the flavor up in this dish a lot. So as it says right there, this curry is full of flavor. And I really encourage you all to get out there and try some of these root vegetables. Eat with some squash. I mean, you can take an acorn squash and you can cut it in half, put it straight onto the grill. You can put it in slices and put it onto the grill, and you can eat the skin on the delicate squashes. It's so tender. And so really just go out there and have a lot of fun with all these pumpkin, squash, and root vegetables that are out there now. So that's what I got. I'm going to go over to the chat box here and see if we have any questions.
And Everly, if you can put the website into the chat box when you get a chance.
There you go. Just dropped it in there right now.
Excellent.
Awesome. Does anybody have any questions on the recipe or a comment that they would like to share?
I do see one here from Warren says, I see a photo of pasties, or said pasties below the curry recipe.
Yeah, so here's a great thing. So at the end of each recipe, what they do is then they offer more recipes. So it's real nice. Then you can say, oh, so those are empanadas, some homemade empanadas. But, you know, you could call it a pasty. We're in Wisconsin. You could make your own version of a pasty. I think that would be completely acceptable. What would be really cool is what they're going to put inside of these is going to be that meat mixture or that veggie mixture. But I'm super impressed with the recipe content from PCRM. And I can say that I'm starting to teach more upcoming classes. We just taught 2 weeks ago, I taught a fall soup and stews class, and it was well attended. We had a really good time. And for November 18th is the next cooking class coming up. It's going to be with West Dallas Recreation. I'm starting to do some daytime classes now. So this class is 10 a.m. to 12, and then we eat, and we're doing a holiday meal. So we're going to do plant-based for the holidays, some cauliflower mashed potatoes. We're doing a mushroom gravy that goes with this. So there's a lot of yummy stuff that's coming up. And then in the new year, I'll have plenty of time to announce this, but we've got a Kickstart class coming in January, some classes on hormones and cancer into the early spring. So it's got some fun stuff coming up now that we're back and starting to do cooking classes again.
It's great to have a holiday. Great to have the holiday cooking class coming up, because that so often is a time when things can kind of get sabotaged when you have the family get together,
Yeah.
and if there isn't a plant-based option there, it gets kind of difficult, and you just as soon be in a position where you're not putting anybody out. So if you have something that you can bring or that you ate before you got there, that makes it a lot easier to enjoy the holidays.
Yeah, I agree. And also real quickly, I know I'm over my time, but I just wanted to share. So I've been invited to speak at the healthcare management for female executives conference coming up in November, and it's going to be out in Milwaukee. And I'm going to be doing the networking event that takes place on Thursday before all the main conference starts. And they've invited me, and it's some contacts I met through cooking classes who have now switched and gone plant-based. And they really wanted me to bring the importance of plant-based to this medical conference. And so I get to do cooking demonstrations, and the entire event is not event, but the entire networking event is going to be catered by me. And we're going to be teaching them, we're going to do a mashed potato bar. We're going to be doing a taco nacho bar, and we're doing a tofu chocolate mousse. And then I also get to talk with these healthcare executives about how important the message of plant-based is, and how the layperson like myself, we're so needing this information, and how important it is to be able to hear this message echoed by our clinicians and physicians. So I just want to thank all of the doctors to share with us tonight. Thank you so much. And please keep sharing with your patients. It's so needed, and we need to keep hearing more of it. So I'll zip it up and turn it over to Dr. Liberman now. So thank you all so much, and it's great to see everybody.
Good luck at that conference, Emily.
Thank you. And Donna, I'll put a link in here to my cooking classes, and then that way you can take a look at those as well.
And also quickly before Dr. Liberman, Robert asked, when do you think we'll be meeting at the library again? Miss seeing everyone's faces, and I think that's echoed by a number of people. We're probably not until the new year, but we'll make sure that everybody knows about it well ahead of time.
Okay.
With that, thank you so much, Amberly.
You're welcome.
And, we'll go to our featured speaker tonight, who is also familiar to many of you. He's a fellowship-trained cardiologist practicing cardiology at Ascension Columbia St Mary's here in Milwaukee. He is also a member of the American College of Cardiology's National Prevention Work Group, whose membership includes nationally known physicians such as Dr. Dean Ornish, Dr. Caldwell Esselstyn, and Dr. Neal Barnard. He is an advocate for the use of plant-based nutrition to help improve heart health, general health, and quality of life, and has seen the benefits of plant-based nutrition in both his personal life and that of his patients. We are fortunate to have him practicing here in Milwaukee, and we're fortunate to have him as our PB&L medical director. I'm happy to welcome our featured speaker tonight, Dr. Joshua Liberman. Okay, try that. Oh, there we go. Thanks.
Oh, okay. Well, there you go. Thank you. All right. So sorry for this bumbled start to this, and we're already 15 minutes late. So I appreciate everybody who's staying on for their patience. But yeah, Terry's right. I'm a cardiologist in town. I know a lot of the people on this call know me. Some people may be new though. And I guess what I want to talk to you about tonight is first of all, the importance of heart disease, and then what we can do about it, and how potentially a plant-based diet can really help with the management, prevention, and treatment of heart disease. So heart disease is the #1 killer in the country. So someone dies of heart disease every 47 seconds, as 37 seconds in the US. And there's over 2,300 deaths every day from heart disease, which by the way is more than COVID right now. Next slide, Terry, page down.
Okay, sorry, and now there we go.
So this is just some recent statistics from the American Heart Association. Really, I guess what I want you to focus on is that second column, which is cancer. So that's all types of cancer combined. All types of cancer combined don't equal each year the number of people killed by heart disease. So number of deaths from cancer doesn't even equal, even if you combine them all. And I think a lot of people out there are under a misconception that that's not the case. So you can advance. And then just a short amount of time from now, under 15 years from now, almost half of the US population is projected to have some form of cardiovascular disease, whether that's heart disease or plaque in the neck, or have history of stroke or blockages in the legs or anything like that. Next slide. And over the course of the last 50 years, it hasn't changed, unfortunately, despite all these advances and tremendous progress we have in medications and procedural therapies and interventions and all the truly wonderful, miraculous things we can do. We can't move heart disease out of #1. My mentor and a previous speaker here, Kim Williams, who's chairman of the cardiology department at Rush University. He's the former president of the American College of Cardiology, and he used to say his rallying cry is he wants to be able to cheer, "We're #2, we're #2," finally, because he just wanted desperately to get out of that #1 position. Finally being proud of not being first. Next slide. So as I said, we've made tremendous progress, and there's so many things we can do, from decreasing the time it takes from someone presenting with a heart attack until we intervene. And we know that that's a critical amount of time, because every minute is more heart cells that die off. We have all these wonderful advances in stent technology and better and more effective medications to take after the event, and advances in support devices. But unfortunately, none of these have reduced significantly have changed the fact that heart disease is the #1 killer. So advance. And so, because the problem is that we haven't made any great progress in preventing heart attacks, right? We've made tremendous progress in treating them, but not preventing them. And unfortunately, still about 50% of patients, the initial presentation of heart disease is a heart attack, or worse, even death, right? So that's the first inkling that we get that somebody has heart disease, is that they just had a heart attack. Next. And we know that, you can say, well, it's okay, I'm not at risk because, my blood pressure is controlled, or I'm not at risk because my cholesterol is controlled. And unfortunately, that's really not true. So if you never had any risk factors to begin with, right? You were born with a great gene pool, and you didn't have high cholesterol, you didn't have high blood pressure, you didn't do that, and of course you didn't start smoking or anything silly like that. Those patients, those people who from inception, from birth, basically, they reach midlife and they have optimal levels of everything, and they never had any problems, they have a very low lifetime risk of developing a problem. The problem is that not everybody's like that. And right, for the rest of us, those who have had high cholesterol in the past, even if it's controlled now, those who have had high blood pressure in the past, even if it's controlled now, lifetime risk is about 30% for those who even have just one risk factor, especially if it's not controlled. And if you have 2 uncontrolled risk factors, it's up to 70% lifetime risk of having an event. Next. And so there's a lot of reasons that we don't do a good job of preventing heart disease, or we don't catch enough people with heart disease. Part of it, and maybe I shouldn't have begun with this because this isn't the major problem, but it is a big problem, is that the U.S. Healthcare system really doesn't incentivize prevention or nutrition or anything like that, right? It incentivizes rescue treatment, it incentivizes procedures, it incentivizes medications. Next slide. But, I think in some ways a bigger part of the problem is that we just aren't systematically identifying people at risk, right? So most providers use things like a cholesterol panel, whether or not, they ask you about your family history, they ask you if you have diabetes or high blood pressure, if you've been a smoker, and that's all well and good, and that will tell us a lot, right? I already told you that. But unfortunately, it doesn't tell us the whole story. And so there are other things that may need to be done. I put in quotes here, advanced blood tests that, aren't necessarily really even advanced, right? It's just looking for different risk markers. And then it's looking for, instead of risk factors, what we now call risk modifiers. So other things that maybe don't carry the weight of a risk factor like diabetes or smoking history or a history of tobacco abuse or something like that. But they do modify the risk, right? And so this is, if you come from South Asian descent, right? So if you're from India or Pakistan or Sri Lanka or somewhere like that, we know that that there's higher risk, and it's probably genetically based, but there's higher risk. If your triglycerides are high, which are not considered a classic risk factor. So if you have moderate kidney dysfunction, again, historically not considered a major risk factor. But we're seeing that there are these other factors that we have to take into account that not everybody does. And then there's imaging tests like something called a calcium score, which is not going to be the focus of this talk, but I keep thinking, Terry, we should do a talk on that at some point. And maybe if we don't have a speaker lined up in the future, I'd be happy to talk about that. Next slide. And then yet another part of the problem is that, the reason we have so many people dying is that angioplasty, stents, things like that, treatments that we do, interventions that we do, only treat the most obvious blockage, right? It's the 99% blockage that somebody comes in with. The problem is that usually only represents the tip of the iceberg, right? That if somebody has one blockage, they're definitively likely to have more plaque elsewhere in the body or elsewhere in the heart. And unfortunately, it's those other plaques that they don't have to be 90% before they rupture. They can be 20% or 30% before they rupture. And so hit next slide. See if the animation works. Nope, went the wrong way. Sorry, Terry, I've put you in the driver's seat and put you on. Yeah. So and so this is the little Dutch boy putting his finger in the dam to try to block all the different cracks and all the different holes. And that's really what heart disease is. We can put a stent in the biggest leaking hole, but there's a lot of other cracks in that dam. And there's definitely other areas that are going to be an issue. And that's really the problem with stents. Stents are wonderful and they're life-saving if you come with a heart attack, but they're no way to prevent future heart attacks. Next. So, if we're so bad at identifying who's at risk and we aren't even incentivized to try and find these people, and procedures we do, don't even necessarily prevent heart attacks, what will prevent heart attacks? That's really what we have to do. We have to prevent heart attacks. So next. So here's a slide that came out of a study called the COURAGE trial, which the trial looked at patients who had heart disease and were treating them with either stents or with what's called optimal medical therapy. But I want to highlight something else, which is these graphs, and again, since I can't control it, I apologize, but you see on the right, it says 0, 1, 2, 3, 4, 5, 6, and that is number of risk factors controlled. And so if you have, thanks Terry for highlighting this, if you have 6 risk factors controlled, you had the lowest rate of death over time in this study. And so that's really the moral of the story, is that it's not stents, it's not medications, it's not anything. It's making sure your risk factors are controlled. You can go to the next slide. Oh, no, went the wrong way. Right. So despite optimal medical therapy and stents, 10 years after randomization, the patients that had the lowest mortality were the ones where they had all 6 of these bolded risk factors adequately controlled. And guess what? Everybody here on this call knows where I'm heading with this. That's what a plant-based diet will do. Next. And so, the medical community is coming around to this. So this was, the editorial that accompanied when this study, when it was published in the Journal of the American College of Cardiology, the editorial's headline was "Do not smoke, eat healthy, and exercise." Right? It had made no mention about stents, made no mention about medications, made no mention about anything else. It was simply focused on these 3 things. And the quote I pull out from this is, "The importance of lifestyle change, in addition to intensive pharmacologic management and secondary prevention, is often underestimated by patients and maybe, and I'll put in my editorial comment, more importantly, by clinicians alike." Next slide. So as I said, the editorial recommended smoking cessation, eating healthy, and exercising. Next. And why? Next slide. Yeah, because ultimately, no, you're right. Ultimately, it's our lifestyles that are killing us. And you can see here, I think diabetes is affecting my eyesight. I have trouble seeing the consequences of poor food choices. Next slide. Right, so we know, and everybody in this call, and what Terry said in the very, very beginning of every single call, improvements in dietary intake have been conclusively linked to decreases in rates of heart attacks and strokes and different kinds of cancer and diabetes and hypertension, autoimmune disease and dementia. Next. Right, and so you hear that, right, and you say, oh, great, I'm going to improve my diet. Absolutely, I'm going to do this. And this is what I tell my patients. If you improve their diet, you're going to have a lower rate of this stuff. And they're great. How do I do that though, right? Next slide. Yeah, and that's the problem, is that there's such a huge confusion out there in the community. There's all these different diets that are being hawked at all times. And, you can call them fads, but people say plant-based diets are fads. So next slide. Right, so there's a huge confusion out there. You just hit return or next page down a couple times probably. Right, do we do plant-based or Mediterranean or raw or wheat belly or paleo or keto? Next, yep, hit it again. Or low-fat carb, I guess that's reverse. I apologize, the animation came out messed up. But these are all the different, these are not even all. These are just some of the more popular ones that are out there. And it's hard to know what is the healthiest, right? Next. All right, that's weird. Sorry, thanks. Well, again, I've shown this slide before, but the bottom line is that we know that plant-based or vegetarian diets have been shown to do a lot of beneficial things. A lot. Next. And we know that in observational trials as well as clinical trials, populations or groups that eat primarily plant-based diets have significantly lower cholesterol levels, and as a result, probably lower rates of death from heart disease. Next slide. But again, is it just a fad? And I would argue no. And again, I've shared some of these slides a number of years ago, but I thought it was interesting to do again, advance again. And I do want to take a few minutes to talk about the Kepner rice fruit diet again, which is, probably the oldest known therapeutic plant-based diet, right? So purposely for the designed purpose of lowering risk of bad things happening, rather than I think I'm going to get healthy or I think I'm going to lose weight. Next slide, or hit return. Right, go ahead. So Walter Kepner was a physician refugee from the Nazis who came to the U.S. Before the war really broke out. He began this rice diet program at Duke University in North Carolina in 1939. Right? It's hard to say that this is a fad when we've been doing it since the 1930s, right? Since the Roosevelt administration. The treatment was a simple therapy of white rice, fruit juice, and sugar. And again, I'm not saying that we should be doing this now. I'm not saying that this is what we would be consistent with a healthy diet now. But it was a thoughtful, intentioned diet that was purposely created to lower the risk of stroke and heart attack and high blood pressure. Next. All right, so it was aimed at 2,000 calories a day. And there's the breakdown. It's not that important for the purpose of this conversation. I think it is important to note that the sodium content was very, very, very low, and much lower than the current average. Now, again, at the time, the average sodium intake was a lot lower than it was now because they didn't have as much processed food as we do now. But it was still a dramatically low sodium content. And he did some vitamins and citrate-containing fruit juices to avoid acidosis and stuff like that. Next. And he found that this was very effective at controlling blood pressure. And one of the reasons he found this was that, he put a patient, a 33-year-old woman who had horrible blood pressure. So she had kidney problems, and she had some major changes in the back of her eye that showed that the blood pressure was really starting to wreck her eyes and her kidneys. And he said, I want you to do this diet for 2 weeks. And she misunderstood because he had a very heavy accent. She thought he said 2 months, and she came back in 2 months. And next slide. And of course, she had a dramatic reduction in her blood pressure. Her eyes looked dramatically better. She had a noticeable decrease in heart size on chest x-ray. And of course, there were no signs of nutritional deficiency, which is one of the arguments at the time, saying, oh, no, you can't do that. People are going to get sick. Next. And so, they had trouble recruiting patients. So this is a very, very, very strict diet, very atypical diet, but go ahead. Next slide. Yeah, but it gained momentum, and he presented it at the American Medical Association conference in 1944, and he basically got laughed out of the room. He was called a fraud. Next slide. Yep. Bunch of journals rejected it. He did get it published. And of course, 5 years later, 5 years after he published it, New England Journal of Medicine, which is, the premier journal, said at the time, practically speaking, there's probably no more effective diet for obese decompensated cardiac patients. And although the regimen is certainly not the final answer to the treatment of high blood pressure or the diseases that result from high blood pressure, it's an important development in the search for a practical and uniformly successful method of treating the disorder, right? Think about that, how long ago that was. And the New England Journal is saying, yeah, actually, this makes sense, right? And we just haven't learned anything in the ensuing 80 years, right? We just haven't advanced. And part of it is because we've been hijacked by the food industry, and part of it is we've been hijacked by, a lot of other things. But I'm here to tell you that plant-based diets are not a fad. They've been out for a very, very, very long time and used for therapy for a very long time. Next slide. And so the question becomes, well, what is it about plants that makes them so healthy? And again, most of the people in this call, this stuff is going to be repetitive for all the other, speakers that have ever presented. But go ahead, next slide. Bottom line, plants have protein, right? Plant-based proteins are different than animal-based proteins. They have many of them have monounsaturated fats and polyunsaturated fats, and of course, there's tons of fiber, right? And obviously, I'm coming at this plant-based diet speech and practicing cardiology from a position of not being anti-oil, anti-fat, right? That's not my approach. I'm not saying that if you do that, you're wrong. I'm not saying that if you don't do that, you're wrong, right? I'm just saying that that's not my approach, but because I think that there is a lot of data that polyunsaturated fats are very healthy, monounsaturated fats can be very healthy. And if you disagree with me, no problem. We can live together very nicely. But I'm just trying to say that there are a lot of benefits to foods that come from plants versus the foods that don't come from plants, right? So animal-based foods have not just saturated fat and cholesterol, but they also have heme iron and TMAO and advanced glycation end products and heterocyclic amines and carnitine and taurine and choline and all these other things that appear to be bad actors. Next. All right, so just starting with plant proteins. We know that intake of plant protein and not animal protein has been associated with favorable changes in blood pressure and weight and insulin sensitivity and risk of type 2 diabetes and reduction in the fat that surrounds your liver or the fat that surrounds your heart. And there's a bunch of resources if anybody's really interested, but take my word for it. There's a lot of data that support this. Next slide. Much lower risk of diabetes. And so what this chart is showing you is that if for each of these things, if you substituted in plant protein versus one of those things, that's how much you'd improve. And what, for those of you who aren't familiar with this kind of a plot, it's called the forest plot. The vertical line is if there was a neutral change, if there was no effect whatsoever, if change substituting made no difference whatsoever. And the more to the left the line gets, the more beneficial the change is, or the more beneficial the intervention is. So you can see at the very bottom there, processed meat is the furthest to the left, with that black dot being furthest to the left. That means if you take out processed meat and put in plant protein instead, that's the most impactful change you can make. And it just, and the change, is still significant, but it decreases from there. So red meat and eggs and poultry, again, any of these things, taking out those things and replacing with plant protein, you're going to see benefit. Next line. And we know that Amberly talked about lentils, which are, amazingly healthy and of course delicious, but higher intake of nuts and grains or legumes, such as lentils or chickpeas or things like that, was associated with lower heart disease related and all-cause mortality. You can see those lines to the right. The more you ate, the more your risk of dying went down. So risk of dying is on the left side of that curve going up. It's the vertical axis, and the horizontal is the more whole grains you eat. The next slide. Yeah, and so, in observational studies that collectively have looked at almost 250,000 lives, if you took out 3% of your energy from animal protein and you replace that 3% with plant protein, you'd have dramatic decreases in cancer mortality, heart disease related mortality, and even just total mortality. And so if those of you who are trying to do math in your head, like, oh, gee, what does 3% mean? Go to the next slide. And just return one more time. Next slide. Yeah, so 3% is what's not being shaded, right? It doesn't take a whole lot, right? It's a very small portion of a can of beans. It's a small portion of a packaged tofu or a small portion of edamame. That's what 3% is. So if you took out 3% of your diet from animals and replaced it with just that much edamame, you'd have a significantly lower risk of dying from any cancer. Next slide. So of course, as I said, plants have monounsaturated fats and polyunsaturated fats. If you don't believe in oil, you can mute the talk for the next 1 minute. Next slide. Yeah, don't ever call an avocado fat. They're very sensitive. Next slide. So, monounsaturated fats they're omega-9 fatty acids, the major source. They are the major source of fat in the Mediterranean diet. We know that Mediterranean diets are typically very, very healthy. So it's mostly olive oil, but other examples are, peanuts and avocados and nuts. And I have a joke in there if anybody notices. Cannolis. Cannolis do not produce canola oil. Next slide. Yeah, so canola oil comes from rapeseed. And so we again, similar, if you replace 5% of your energy of saturated fat, replacing it with unsaturated fat, monounsaturated fat, you get a lower mortality. Next. And with polyunsaturated fat, it's even more powerful. Next slide. So polyunsaturated is going to be your omega-3s. And here's just another slide saying that basically, again, taking out saturated fat and replacing it with one of these things, the more the bar goes to the left, the more the benefit is, right? And so you can see if you replace saturated fat with carbs from refined starches and sugars, that's that fourth row, the yellow bar. There's no difference, and in fact, there's an increase. And this is what happened in the 80s, right? The whole medical community came out and said, oh, we need to go on a low-fat diet, no low-fat, and they didn't specify, they didn't highlight the difference between saturated and unsaturated fat. And so everybody took all fat out of their diets, and of course, what did they replace with? Well, if you take fat out of your diet, you're almost definitely going to replace it with carbohydrate. And so people replaced with carbohydrate. They didn't get any healthier. They gained weight. They developed diabetes. And they screamed at their doctor saying, I don't understand. I'm doing what you told me to do, and we're getting less healthy. And that's unfortunate, but it's true. Next slide. Just a different way of saying the same thing. Trans fat's the worst, so we know that. Next slide. And then fiber. Next. Yep, keep going. Thanks, Terry. I appreciate you doing all this work. You know, our ancestors ate up to probably 100 grams of fiber a day, and we're around 15 on average. Now, people on this call may be more than that. You know, plant-based people are going to definitely be more than that. But the American Dietetic Association recommends at least 20 to 35. But again, our ancestors ate a whole heck of a lot more than we're doing. And we need to be increasing our fiber intake. Next slide. We know that fiber does a myriad of wonderful things. Next slide. And bottom line, reduce the risk of death from a lot of different reasons, a lot of different causes. Increasing fiber intake is associated with lower rates of almost everything bad out there, except Facebook. Next slide. And significantly lower the risk of total death. 22% decrease in the risk of total of death with in the highest intake of fiber versus the lowest intake of fiber. Next slide. Yeah, and cancer, which everybody's worried about. Again, it's not the biggest killer, but everybody's worried about it, and rightly so. But 40% lower risk of dying from cancer if you eat a high fiber diet. Next slide. And of course, how much fiber is there in pork or bacon or beef or chicken or fish? There's none, right? And that's part of it right there. That's why plant-based diets are always going to be better. Next slide. And it's more than just one. It's not just about proteins or fat or carbohydrate or anything like that. It's really what what it does to your microbiome. What your genes. Next, you can go to the next slide, Terry. We know that plant-based diets, Dean Ornish has published research that it upregulates disease-preventing genes, it downregulates oncogenes that promote breast cancer, right? So if you downregulate an oncogene, you're decreasing the risk of cancer starting. It's downregulating genes that promote inflammation. And so there's just a lot of data that eating healthy affects us on a genetic level. It affects, so it doesn't change your DNA, but it changes gene expression, which genes are going to be copied and produced. Next slide, which protein, yeah. And then we also know that it decreases inflammation. And if, on the other hand, if you increase a pro-inflammatory diet, which is, all the stuff that we would never eat, you can have, serious health issues. Next slide. And again, we can fly through some of these next, but what don't they have? Again, red meat, bad stuff, right? Increases risk of a lot of bad stuff. Next. I want to, I think it's worthwhile taking 10 seconds to focus on this. And this is just, I want you to note that those curves are increasing levels of red meat intake. So as your red meat intake goes up, those curves go up to the right, which is risk of mortality, right? So as your intake, the quintile 5 means the fifth is the people who eat the most red meat have the highest risk of death compared to the lowest quintile. Now, quintile is when you divide the group into 5. So the highest 20% versus the lowest 20%. Next. And again, we know that meat intake, if you compare the highest, if you divide it into groups of 3, so tertiles are dividing the groups into groups of 3, the lower group, the group with the least amount of red meat intake, has the lowest all-cause mortality, CVD mortality, type 2 diabetes, right? Again, so it's just highlighting the same thing, is that people who eat a lot of this stuff have a lot of bad problems. Next slide. Same kind of stuff. Processed meat's really bad. Next slide. Right, and so if we could just, this is basically saying the same thing I said earlier, if we could take 5% of energy from saturated fat and change it into unsaturated fat, we'd reduce the risk of heart disease developing by 42%. I mean, that's immense. That's more than, all the medicines we have combined, basically. Next slide. Yeah. And of course, it's a public health issue. I mean, we have 200,000 deaths a year in the US that are entirely preventable, that we could get rid of just with a moderate decrease in red meat consumption. We're not even talking about banning it, but just if we could moderately reduce it. we could save 200,000 lives a year. I mean, just think about that. Next slide. And we know that this works, right? I mean, you could say, well, what's the proof? Well, we know it works because Dean Ornish did this trial, 30 years ago at this point, where he basically took a group of people who it was recommended that they have heart surgery. They had such severe heart disease that it was recommended that they have heart surgery. And he said, no, give them to me first. And he was a resident, a medical resident at the time. And so he wasn't even, a practicing doctor yet. And he took 48 people, 28 of them, he put it in the experimental group, which was a combination of diet and smoking cessation and group therapy and exercise compared to a usual care control group. And he had them all living in a hotel for 3 months. And of course, this is early, so they didn't even basically have statins or anything like that back then. Next. Yeah, you can go through all these. So this is what the diet was, but it was basically a plant-based diet. He allowed some dairy in the early iteration of this, and egg whites. Next slide. So basically, it was a whole food plant-based diet, right? Avoiding simple sugars. Next. Next. So we don't have to spend much time on this, but it successfully lowered cholesterol. You can hit next. Yeah, it successfully lowered cholesterol, and the people exercise more. It successfully lowered a bunch of the numbers we look at, which makes sense because if you're not eating animals, then you're not eating any cholesterol. Next slide. And what did he see? That these people who it was recommended that they have open heart surgery, there was a 91% reduction in how often they were having angina. There was a 42% reduction in how long the chest pain lasted. And there was a 28% reduction in the severity, right? This is just in a short amount of time from changing the diet and doing, and actually a lot of these guys probably couldn't even exercise at first, but they got to be. And of course, the other group had an increase in all those numbers. Next slide. And of course, it makes sense, but the people who were most adherent to the diet had most benefit, right? That makes sense. Next slide. And then if they look 5 years later, when they did heart catheterization studies, they saw that it actually was melting away disease, which makes sense. Next slide. So we can fly through some of these. Yeah. So the patients in the experimental group, actually go back one if you could, sorry. Almost 80% of them got so much better that they were able to stop most of their medications, right? I mean, again, that's what it's all about. And none of the patients in the control group, right, the standard care group, were able to stop any medications. Next slide. This was just a large observational study that looks at the Seventh-day Adventists, many of them living in Southern California, but throughout the U.S. and Canada. And next slide. And they are able to, so many Seventh-day Adventists are plant-based in some degree. And so you're able, it's a large population with a lot of people that are plant-based and some who aren't. And so you can compare them. It sets it up nicely for an observational trial. This is the breakdown of what people ate. And if you go to the next slide, they saw that the vegetarian diet patterns were associated with a lot of benefits, right? And again, not surprising after what I've told you. Next slide. Predimed was a Mediterranean diet, came out a couple of years ago. Again, this was Mediterranean, so this is not strictly plant-based, and this did supplement with significant amounts of olive oil. Again, for people who are no oil, that's fine. I don't think there's an issue with that, but I'm just showing you that this is yet another study that showed that diet and nutrition can significantly improve heart outcomes. Next slide. Oh, go back one, if you can, sorry, yeah. And so those curves, so the dark line is the control group, the standard care group, and the green and the yellowish, I don't know what color that is, mustardish lines are the intervention, the Mediterranean diet, either with extra olive oil or with extra nuts. And you can see that there's a difference between those two lines. You want the line to be lower and to the right, because that's comparing rates of death, and that means that there's a lower rate of death over time. Next slide. Go ahead. Yeah, so I mean, you know, again, most people on this call already know this, but there's definitely a convergence of scientific evidence that an optimal diet is mostly plant-based, if not exclusively, consisting predominantly of fruits and veggies and whole grains and legumes and soy products that should be naturally low in refined carbs, saturated fat and trans fat, and high in complex carbs, and, you know, for some people, adequate omega-3s. Unfortunately, in this country, we don't advocate for that, and patients don't necessarily want to hear it either. But give them the benefit of the doubt, because some do. Next slide. And these are popular. They're becoming more popular. You know, this information is becoming much more prevalent in the community because of, you know, honestly, frankly, community groups like this, but also, you know, all the documentary movies you hear about and all these different things, celebrities that are doing it now. The pendulum is starting to swing in the right direction. Next slide. So, you know, the main certification body for dietitians is the Academy of Nutrition and Dietetics, and they came out a couple of years ago basically saying that plant-based diets are healthy, nutritionally adequate, and they say may provide. Again, you know, they're a large body. They have to use cautious words and be very diplomatic, but I mean, it's huge to have them come out with something like this to support this. That's a sea change. And they say that it's for all stages of the life cycle, including pregnancy. And again, there's a lot of people that say, oh, you know, I can't, I'm an athlete, I can't do that, or I'm pregnant, I can't do that. Zero data to support that. And we're seeing that more and more groups are saying, no, very, very healthy. Next slide. International Agency for Research on Cancer has said that, you know, processed meat is carcinogenic, right? That's a huge thing. Next slide. American Cancer Society has called for increasing plant-based foods and excluding or limiting red and processed meat to reduce cancer risk, right? I mean, these are big, big changes for these organizations, which have been very reluctant over time. I mean, American Cancer Society was taking money from, you know, large, like Coca-Cola and large corporations that were part of the problem for a long time, right? So to have them come out with these kinds of things is very, you know, I mean, pardon the pun, but it's very heartening. Next slide. And my organization, the ACC, the American College of Cardiology, in 2019, said that plant-based and Mediterranean diets, along with fruits, nuts, veggies, legumes, and lean vegetable or animal protein, preferably fish, are recommended for primary prevention, which is meaning you have some risk factors, but you've never had an event, right? It's saying if you want to prevent an event, focus on nutrition. That's a big thing. Next slide. So, concluding with Michael Pollan, genius, eat food, mostly plants, not too much. That should be it. Thanks, Terry. I appreciate you doing all that. I'm sorry for everybody that it came a little late. I got to figure out why it didn't work for me.
Just, yeah, I guess I am unmuted here. Josh, thanks so much. That was excellent. And even at that accelerated pace, it made it, I think it sinks in that much more.
Yeah, I'm sorry if I went too fast, but you know, at some level, the people on this call, most of them already have seen this or known this, so it's preaching to the choir. You know, I do try to get out to community groups and talk about this to people who haven't seen this before, right? But it is nice to reinforce. It is nice to just feel good about what you're doing and to maybe give you a couple more data points to when you're talking to your neighbor or your friend or something like that.
Well, keeping with our 7:30 ending here, you came in just at the right time there. Very, very well timed. So I'm sorry we don't have time for Q&A tonight, but hopefully, you know, if you have a question, if you write it down, Josh, you're going to be with us in November, right?
Oh, for sure. And I'll stay in the chat for a little longer if you know, if anybody has any burning questions.
All right, that sounds good. If somebody's got a question, you can either put the, I'm trying to think what the icon is here. I think there's a raise your hand icon, or just turn on your video screen and put your hand up. I'll give it 5 or 10 seconds to see if something pops up. Okay, Dr. Blomel?
Yeah, thanks, Josh. That's a really excellent summary and overview. Do you think with where we are in general with the population that when you're talking to community groups, people that are attending these things, do you think the issue is that they just don't know, or that there's just how to even proceed because they're just so the culture is just so, there's so many things lined up against people to be successful here? Is it a practical issue, or is it knowledge, or is it both?
Well, it's both, but I will tell you that in the last couple of years, there's been a dramatic improvement in the responses I get when I talk to community groups. So first of all, I think it's important, as you said, for this group, again, it's mostly preaching to the choir. Most of the people in this group are already doing this, or are mostly doing this, and have a lot of information and have access to Amberly and all these great ideas about how you can put it into practice, right? For community groups, regular community groups may not have that. So I always try to split my talk, with a portion of the talk talking about the data and why it's important, but another portion of the talk talking about practical things that they can do in their lives that will help them move them in this direction. And so, and anybody, you obviously we're just meeting, so you don't know me, but that's a big part of my practice is what can I tell my patients concretely that they can do in their lives that they can take home, rather than these ideas and notions, and then they come home and they look in their pantry and they say, what the heck do I do with all this stuff? Like, I don't even know what to do. So I give them concrete steps, a couple, first things to do. I give a handout for my patients with 5 rules on it. The first rule is, avoid red meat. Second is avoid processed meat. So just simple things that they can do to start moving in that direction. So it's like if you went to college, college, psychiatry 101 or psychology 101, like you have the basics, right? And then they come back 3 months later, and now you're moving on to the 200 level course or the 300 level course, after that. I give patients resources, so a list of resources, So again, and I do this at community groups. I'll put it on the PowerPoint where, here are some websites you can go to start learning, like nutritionfacts.org, Michael Greger's site. Here are the documentary videos. Here are some podcasts for those who like podcasts or audiobooks or things like that. I give them the website for this group. There's all these different things that they can do. It just depends on their level of motivation. But hopefully everybody who goes to the talk can take away, one point of, okay, I'm going to eat less red meat, right? And to me, that's a victory, right? Because I showed you data up there that even if we just modestly decrease our red meat intake, we're going to reduce the risk of cancer and heart disease and stroke and everything, right? So if we can, now again, do I think all my patients are going to become plant-based tomorrow or the day after I talk to them? No. I mean, some do. I have definitely had patients that they met with me, and that night they decided to become vegan, and they've done great, and they're very happy, and they never look back, and they're very, they're doing great. I have other patients that it's more of a process, but the bottom line is, to answer your question, I think people are becoming more and more receptive, number one. Number two is, we can't fall into the trap of saying this is too radical, no one's going to do it, therefore I won't talk to them about it, right? Or picking and choosing, like that's the other trap we fall into as providers, is like, oh, this person looks like there's somebody who has an open mind, I'm going to talk to them about it. But the next 3 people, I'm not going to talk to them about it because they probably don't have an open mind about it. I try to mention it to every single one of my patients and try not to kind of fall into these predetermined, fallacies and notions, simply because I've been surprised. I've talked to patients, and in the back of my mind while I'm talking to them, based on their facial expressions, I say, this person's never going to do anything. And they come back 3 months later and they gave up red meat and processed meat, or they did even more than that. So the reception is getting better and better over time, is I guess the short answer, but I didn't answer it in a short way.
No problem.
Answered it in a good way. Say, thank you so much for that. Elaine, I see your hand up. If you'd unmute. Elaine Jooms.
There we go. Okay, I was trying. Hey, so I have a quick question.
Sure.
Can you hear me?
I can hear you great. Yep.
Okay, so I run into these people who, no pun intended, but they eat meat and cheese and dairy, and they feel invincible because they're my age, I'm 58, or they're younger, and they're flexible, and they run 5 miles, they swim, they do all, they're cardio healthy in their mind. And so I cite the whole thing, you can't outrun atherosclerosis, look at the James Fix book, blah, blah, blah. I'm convinced that they already have atherosclerosis, hardening of the arteries, plaque buildup, and they don't seem to understand that. So is there anything else I can say that can help?
Yeah, tell them that they should get a heart scan. Honestly, is probably the best thing to do. I mean, that's typically my job, is to tell them that, or their primary care doctor job. But heart scans are fancy X-rays of the heart. Basically, it's not very fancy. It's a very low radiation CAT scan. Think of it as like a mammogram for your heart kind of thing. It's $49 at almost every institution in town. Aurora, Ascension, Freighted. I think everybody offers it for $49, so it's really not that bad. And if they truly are healthy, that'll show if they have any heart disease. If they have any hardening of the arteries, it'll show up, and that often is enough to break that false notion of I'm invincible, right? So again, I have a lot of athletes that unfortunately are diagnosed with heart disease, and it shakes their world a little bit in the beginning, because you're right, they thought that they were invincible and they thought that they were doing fine, but they get back to that. They just start eating better.
Well, thank you. And one last thing too, he had a history, this one in particular has a history of heart disease in his family. And I corrected him and said, it's really not a history of heart disease. It's a history of bad eating habits and lifestyle. So
yeah. I don't know. I would beg to differ a little bit on that, only in that, unless you really know what was going on in that family, like you knew the parents. I mean, there are genetics, absolutely. There are things that are completely genetically determined, lipoprotein A levels and other things that are purely genetically determined, and you can't diet your way out of them. You can be the most perfect plant-based, vegan, exercising Buddhist monk living on a mountaintop, and yet you could still have heart disease because of these features. Now, again, is that certainly better than that same person who decides, oh, heck with it, I'll just eat red meat? Of course. But there are genetic factors. So it's not just a family history of eating poorly.
isn't it like 3 to 5% genetics though?
It depends on the data you look at. It's probably higher than that. Yeah, I don't think it's as low as 3 or 5%.
Okay. Well, thank you for your time. I don't want to take up any more.
No, that's fine. And then
I'd say real quickly too, that I did have that test personally and expected to come in, nice and clean, but I wasn't. And it was, I spent my youth believing that you needed to drink a lot of milk, that you needed to eat a lot of meat. And I was, and I ate a lot of cheese. I mean, I was all over dairy and all over meat. So lo and behold, there's a score up there, and that's going to, if nothing else kept me plant-based, and there's many other things that are keeping me plant-based, but that score sure will.
Yeah. And then just to answer the questions, the test that Terry is just talking about and that I referred to is called a heart scan for calcium, or a calcium score. Within the Ascension system, it's a heart scan for calcium, and you can literally, you don't even need a provider. You can just, it's cash pay, $49. There's brochures, and sometimes they advertise it in the newspaper and stuff like that. But you can literally just call up and say, hey, I want one of those, and get it. And you don't even have to have a doctor in the system. Another question in the chat was about olive and canola oils, bad, neutral, good, or unknown. Again, there's definitely some degree of controversy on this in the plant-based world. I guess the answer I typically give to this is it depends on where you are in your health journey. If you already have health problems, if you already have heart disease and you're trying to reverse it, then you might have to be more strict and do something like an Esselstyn plan, a no oil whatsoever plan to try to reverse the heart disease, right? On the other hand, if you're young and you don't have any evidence of heart disease and you don't have any other risk factors or anything like that, and you're doing really well with plant-based, I personally don't have a problem with olive oil in that diet, frankly. I think that there's enough research that shows that it is anti-inflammatory, and it is a good part of a diet that can reduce bad things happening. So I think it somewhat depends on where your health is. It somewhat depends on where your mind is about it. But again, I personally don't have an issue with olive oil.
Steve, are you raising your hand? Steve Ferns, I've seen your hand go up and go down. Oh, no. Okay, it's not a hand raise. All right, if anybody else has a question, just raise your hand or put the icon up there. If
Yeah,
not,
there was a comment about
Donna?
avocado oil. Again, same thing. It's a plant-based oil. I guess the selling point for avocado oil is that it has a high burn point or something along those lines. And so if you it's not going to denature or create free radicals at high heat. But it's going to be the same. Again, if you are unhealthy and working to get healthy, you may need to be more strict and get rid of all oils. If you're overall quite healthy and you want to have some, I think you can.
Sounds great. Thank you, Dr. Liberman. And before we go, let me just remind you that our next meeting will be Thursday, November 11th. We'll have Dr. Michael Lenz. And then December 9th, our speaker will be nutritionist Susan Levin, who's Director of Nutrition at the Physicians Committee Responsible Medicine. And she's a practicing nutritionist and clinical researcher. And she co-authored the Academy of Nutrition and Dietetics position paper on vegan and vegetarian diets, that paper that Dr. Liberman showed from the American Academy of Nutrition and Dietetics. If you'd like to receive notice of upcoming PB Now events and are not currently on our list, you can go to our website, pbnow.org, and just click on the Learn More button. Thanks again to Dr. Blummel, Dr. Strubing, Amberly, for sharing your time and knowledge with us. And thank you, Dr. Liberman, for your excellent presentation. Good night, everybody.